Hey, there we are. Good morning, everybody. This is Dr. Schafer. We're going to do a Sunday stretch today, 9 a.m. I hope you guys are ready. If you don't already have one, grab a belt. I have a bathrobe belt. That'll work fine. A clothesline, anything long like that, a piece of rope. Should work fine. We're going to use it for a couple different stretches. Also, if you have a yoga mat, you might want to use that too. Situate yourself somewhat near a corner or a doorway so that we can use partly the wall and partly the corner or doorway. For some of these stretches, we're going to be doing a fair amount of upper body stretches. I seem to have a lot of patients with shoulder blade pain lately, and what I'm going to do for you guys is focus a little bit more on upper body. If we have some time left, I might even throw in just a few core exercises that I don't always do in my typical core class, but that's time depending. So we'll go ahead and get started. Grab your yoga mat, grab your belt. I'm going to start with up dog. I'm not going to use a yoga mat because I never do, because you can see better when I don't. And I'm going to talk a little bit about why we do up dog. Up dog is one of those exercises I feel is corrective, because when we sit all day long at work, our bodies are kind of rounded forward and our pelvis is kind of tucked under and our spines kind of just round out and sag. And what I want to do with the up dog is put the body in the opposite position, just for variety of positioning, because I think the body just gets stuck in that position. So what I mean by that is, if you have a child like my daughter who's 12 years old and she sleeps in some kind of weird funky position, she wakes up and she's absolutely fine. But if I do that, I'll be hurting for several hours of the day, and it's just our bodies at some point don't any longer have the resiliency to bounce back after being stuck in these weird positions for extended periods of time. Those weird positions, that includes sitting at a computer, which a lot of us do, or driving, which a lot of us do. So, put your hands in push-up position. Go ahead and press up, lazy push-up, let the butt sag down. Eyes forward, take 3 breaths. 1, 2, 3. If you have problems with your wrists, you can do this one on the elbows. This next one I'm going to do on the elbows, just to show you. If the wrists felt good, go ahead and continue to do on the wrists. Press up. On the elbows, go ahead and push high as you can. Try to get that chin up. Take 3 breaths. Back down. If you're doing the regular up dog, make sure your nose is pointing forward. Make sure your shoulders are down. What I mean down here, not like this. I want the breaths to be big enough so that you can hear them. If you're not breathing big, in my experience, you're probably not breathing. If you just count to 10 while doing these positions, it usually doesn't work, because most people can hold their breath for a count to 10. Okay, moving on. We're going to do the opposite, which is not down dog, but child's pose. I like child's pose because the spine really isn't loaded as it is with down dog. And I feel like you can position the hips such that you can actually get a better hip stretch. And considering the amount of people that have pain in the sacroiliac region, I find that to be very helpful with those patients. So I want you to kneel, try to bring your knees apart, go down, arms out in front, 3 breaths. 1, 2, 3. I'm going to show you what the knees look like from the front here. Get the knees apart. Try to get your big toes touching. 1, 2, 3. Come on back up. Take a breath in between. Go back down. Make sure your butt is down as far as it'll go first, and then reach forward. 1, 2, 3. Going back to the positioning of the knees, when you're in this stretched out position, it should feel as if your knees are kind of pointing into your armpits. If they're not, there's a good chance they're kind of pointing together like that. Bring them apart. 1, 2, 3. All right, great. Moving on, we're going to do a wall side stretch. I'm going to reposition the camera here. Bear with me. Want to get the wall into view. One more adjustment. That should do it. We're going to take down this painting here, this picture. Put your upper back against the wall. The feet should be 1 inch or 2 away. I don't really care if your butt is touching or if your butt is not touching, doesn't really matter. Upper back touching, keep the head touching. Lean to one side as far as your body will let you. Once you're there, take 3 breaths. Take note of the top shoulder. You may unknowingly be shrugging it up. Try to let it relax. 3. Same thing to the other side. 1, 2, 3. All right, back to the first side. Hopefully you can go maybe just a tiny bit further. 1, 2, 3. All right, make sure your head stays touching with the wall here. 1, 2, 3. People sometimes ask, what muscle am I stretching here? And I have to say, I don't like really just stretching one muscle. Muscles never work in isolation. And so it's helpful to stretch muscles in groups in which they normally work together. And so you could probably feel this in the neck, probably in the shoulder, probably in the upper back. I keep wanting to roll my head forward today. I keep checking myself. The body's looking to cheat every second it'll get. And I don't mean to say that you specifically are looking to cheat the movement, because people typically don't want to, but the body does, and it's looking for shortcuts in every exercise. I lost track, but because this is an important one, I think we're going to do one more here. I think this is 5 or 6. 1, 2, 3. Your ear should be in a position such that it's sort of simulating you're trying to listen to the ceiling. If you're very stiff, maybe you're nowhere near that, but some of you are probably pushed forward too much. Here, not here, but here. Okay. We're going to go to torso rotation, and we're going to do two varieties on this one. First one, I'm going to do this at an angle here. First one, lay on your back, arms stretched out to your sides, kick up your right leg so that it's a little bit higher than your left leg, which is bent. Drop both down to the left side. Keep your head touching, keep your hands touching. Take 3 breaths. 1, 2, 3. I don't know if you could see it, but my foot is not touching the floor, and that's okay. The point is, I'm letting it drop down as far as it can, trying to relax and breathe. Good. My foot's hitting the wall there. I got to re-angle just a little bit here. One, 2, 3. So this is the easier version. You should be feeling a good stretch with this. If you want to get more ambitious and do a little bit more of a core exercise, in addition to stretching, put both legs straight up. If you can't get both legs straight up, don't do this exercise, because I'm going to drop my legs down to one side. But if you can't get both of your legs vertical with your knees mostly straight, don't do it, because if you're in this position, you're going to hurt your back. If you're in this position with your legs vertical, you're very safe. I'm going to do this version because I like to get the additional core exercise there. If you're doing just a regular hip rotation, that's fine too. 2 more on each side. 1, 2, 3. If you are doing the straight leg version, you may notice that you're starting to fatigue already. And that's okay, because we're only going to do one more anyway. Last one. 1, 2, 3. So we challenged our core in different planes of motion. We've done body extension with the up dog, flexion with the child's pose, lateral flexion each way with the wall, rotation each way with that last one. So we're going to move on to the hips, going back to the sitting position. The muscles behind the knees and the muscles in front of the hips are the most important, because they are shortened when we sit. So what happens is they forget to elongate again when we stand up and start moving. And many of us are stuck in this position without knowing it. Put your hand on the wall, and if you're able to, pull your foot to your butt, then you don't need this rope. If you have trouble grabbing your foot, you need the rope, and I'll show you what to do in just a second. But if you can grab your foot and pull it to your butt, do that. Don't lean your whole body forward. Do try to get your knee backwards just a little bit. Take 3 breaths. 1, 2, 3. Other side. If you can't do this one, bear with me. 1, 2. Again, make sure you're not pitching forward, and try to get your knees together for this one. If you can, grab your foot and try to get your knees together. Don't do it out here. Do it here, and then get your knee back. 2, 3. So the version that I was going to show you with the rope or the strap, put the strap around your foot, lay on your side, slide that strap so it's around the front of your ankle, and then pull it up. Try to get that heel to your butt. In doing so, also try to get your knee backwards, this top knee backwards. And also try to keep your knees relatively together. So now I feel a little bit more rather than up here. 2, 3. Rather than switching sides 100 times, we're just going to pause for a second, do a bunch on this side. If you're doing the standing version, you can continue to alternate right and left. It's a lot easier. 2, 3. 1, 2, 3. I caught my form there. I realized I was kicking my knee up a little bit too high. All right, if you're doing the sideline version, switch sides, put the rope around the bottom of your foot first, and then get on your side, and then slide that rope or strap to the ankle. Keep your knees together. I don't care what your upper body is doing. It could be here, or here, or here. Whatever's comfortable. Just try to keep your knees together as much as you can. 1, 2, 3. 1, 2, 3. If you're lying on the floor, continue to do this one. We're shooting for the 3 breaths 5 times on each side. I just want to get a few more for my sake in the standing version here. I might go for a run after this. 2, 3, if it's not raining by then. 1, 2, 3. One more time, I'm going to tell you to be careful because your body is going to want to cheat and bring the hip way out here. Try to get those knees together. Try to get the knee back. 3. Last one. 1, 2, 3. Next, I know I didn't tell you to grab a chair. I apologize. I should have done that, but most people have a chair not too far away. Whatever you got, sofa fine, ottoman, whatever you have is fine. Even if you're near some stairs going up, that would work too. But what you want to do is just kick your leg out and put the leg up on the chair. Before you do it, you might want to take a look at your feet. Make sure your feet are going completely straight forward. Your body's going to want to cheat, and the foot's going to want to come out like that, especially the one that you're standing on. So if I'm not careful, this leg is going to want to twist out that way. In making sure that it's not, now I could feel the stretch behind my knee much more. Once you feel that, pull those toes towards you. You'll feel a little bit in the calf and probably even more in the knee. Take 3 breaths there. Don't touch your toes. I'm focusing only on those muscles behind the knee. Just for changing up the pace a little bit here, we're going to hold this for a little bit longer instead of 3 breaths. Maybe about 5 breaths. Some of you might not have trouble with the breath on this one. Some people are a little bit less likely to hold their breath on this one. But if you're feeling a significant stretch, be careful, count your breaths. The harder the stretch is, the more likely you are to hold your breath. One more on each side. I've seen this one stretch improve people's low back pain. I've also seen this one stretch improve Achilles tendonitis. I've also seen it improve plantar fasciitis. So if you could show me one stretch other than that does all three, go ahead and show me, but I've never come across such an important stretch as that one. That one and the up dog are probably the two most commonly given exercises that I work with patients. Okay, moving forward, grab that strap again. I'm going to double it up. I'm going to flip it over my back. With my back arm, I'm going to pull down. In doing so, this elbow should come up a little bit. So this is a stretch for the triceps of my right arm. We'll call that 3 breaths. Let's switch sides. Grab it with your left. Flip it back. On the back side, pull it down with your right hand. The next time we do this one, I'm going to add to the stretch by doing it up against the wall. So I'm pushing this way against the wall and pulling down with this hand with the strap at the same time. So getting a little bit extra stretch in the lat muscle, latissimus dorsi, as well as in the trapezius. I'm squatting a little bit so that you can see it. You don't have to squat. I really like this stretch, doing both at the same time. I find that when the lat muscles get tight or shorten, they oftentimes actually shorten because they're weak and they don't get used very much. So number one, find some activity that uses them. Swimming, rowing, lots of activities, pull-up type motions. You could just do a lat pull-down machine at the gym if you're going to a gym. But those lat muscles do tend to atrophy, and while they're going through that atrophy, oftentimes they will shorten just because they're one of those muscles that positionally, when we sit and work at the computers, they are in the shortened position. So while we're by the corner here, or the doorway, wherever you can find to do it, I'm going to put the strap down, and I want to do a very, very gentle pec stretch. You're going to have a tendency to do two things. You're going to want to lift this shoulder. Please try not to. You're also going to want to hold your breath. Please try not to. Put your arm up like that, like you're signaling for a turn. Very, very gentle lean forward. You don't have to thrust your shoulder up or back or pull like this. In fact, I'd prefer you didn't. If you are not relaxing into the stretch, there's no point in doing it. If your whole body is tense, there's no point in doing it. You're signaling to your body, to your brain, and you're saying, hey, don't bother relaxing into this position. I don't plan on getting into this position again anytime soon. There's no point in getting used to it. But if you can get into the position and breathe or talk like I am, then you're at least relaxing the muscles enough to signal to the body to say, hey, relax. This is a position that's okay. You don't have to be fearful of dislocating your shoulder. Two, three. You may notice one side being a little tighter than the other. If you want to focus on that one side that's tighter or shorter and just do a couple more repetitions on just that side, go right ahead. I do that sometimes with patients. If things are obviously asymmetrical, it's okay for your workouts to be a little bit asymmetrical. I say a little bit, not completely. You definitely would want to do both sides, but you can do the one side a little bit more if you want. Last time. So this routine we're doing today, a little bit more focus on the upper body. Why is that? Well, a lot of my patients have been coming in with shoulder blade pain. If this sounds like you, this is a great class for you. Most of those patients also have jobs that require them to sit all day, so I feel it's important to still include at least the hip flexors and the muscles behind the knee. Next stretch we're going to do is for the biceps. This area right here. When we're sitting at the computers, those muscles shorten. Make a fist. Put this part of your fist in the corner or in the doorway. Very gently lean forward and very gently turn the other way. Now, again, keep the breath pattern of 3 breaths and then switch sides. I'm going to keep talking. But you don't want to thrust the shoulder up. You don't want to push so hard that you're holding your breath. You do want to gently wade into the pool of pain. What I mean by that is I do expect some of these stretches to be slightly painful. And I find that that's the biggest reason that most people don't want to stretch. So, take the pressure off of yourself. Just say, hey, a little bit of pain is okay. Wading into the pool of pain slowly is ideal. You don't want to jump in head first into the pool of pain. And then that's when your body reacts and says, I'm going to tighten things up even more in response to the pain. I really like this stretch. I think the biceps are often neglected as far as stretching them goes. If you're flexible enough, you may get to the point where you're also stretching out your front deltoid here. The biceps long head also crosses this joint, so it may be one or both of those muscles, but like I said, I don't often say, hey, let's focus on this one muscle. What I'm really doing here is focusing on the elbow joint, the muscles on this side of that elbow joint. So call it what you want. Call it the biceps. Call it the elbow flexors. I lost count. We're going to do one more on each side. Remember to relax that shoulder. Make sure you're not thrusting the shoulder up. 1, 2, 3. Good. Last, well, this might not be the last one. We'll see how we do on time. I also want to stretch your wrists and forearms. This is a position your body doesn't get into very much. These bigger muscles in the forearms do tend to get a lot of use. We're not going to put a lot of focus on this one. I'm not going to focus too much on the breath on this one either. But I do think it's helpful in as much as, especially if you have a job that requires gripping anything. Maybe you were raking over the weekend. Maybe your shoulder pain is actually from a muscle that you strained in your forearm. It's possible. Where the pain is and where the problem is isn't always in the same place. In fact, I usually find the most significant problems are away from where the pain is. The pain is just where the pain is, that's all. It's important to identify what is hurting and give it a diagnosis, but that's only a classification system. That's not necessarily the end of the story. Lots of people can have rotator cuff problems, but unless you go the extra route to figure out why they have the rotator cuff problem, you're really not helping out the patient. Are they having a rotator cuff problem because they're swiping at a cashier station 100 times a day? Or are they mousing with the right arm and this is what the rotator cuff muscles do? Or are they swinging a golf club and maybe this shoulder, that rotator cuff is bothering you from that? Or maybe it's none of those. Maybe they're not doing any of those and they still have rotator cuff problems. Then why? So I see that a lot too. Retired people, rotator cuff problems. It's not as cut and dry as everybody thinks it is. Okay, moving on. That's the gist of the upper body. So this session was mostly focused on people that sit at a computer most of the day, at work or at home due to COVID. So as a result, a lot of these stretches are really good to do as a break from being at the computer. So if you're working at home by yourself, and if you can get down on the floor and do some up dogs, please do. Heck, if you did them once an hour, that would be a great start. If you threw in also some of these stretches, that would be a great second exercise. If you also threw in some of these wall side bends, that would be an even better combination. In fact, those three things would probably be my three most commonly given exercises at this point. This side bending one, do be careful because your body will trick you into thinking you'll go and then your body will say, oh, that's as far as you can go. But I want you to be able to push just an inch or two more and continue to breathe. Try to get that ear up to the ceiling. I've seen a lot of good benefit from this exercise lately. I feel it's because when we sit at the computer, yes, most of us slouch forward, but most of us also slouch sideways, that or that. We don't know we're doing it, and it's a very difficult thing to correct. So what this does is it helps realign our muscles to hopefully keep a straighter spine in this plane. When we're in this plane, you want to have a straight spine. When you're looking at somebody from the side, there should be some curvatures in the spine. Those are there for a reason. They help the spine act like a spring in addition to the intervertebral discs. But that was a really good class in and of itself. I'm going to stop it there. This was about 30-35 minutes minus my talking. So next week We'll focus on the hips a little bit more, but for this class, this is a great class to do as a break from being at the computer all day long. So feel free to go back and use this video as such. Have a great weekend, or the rest of your Sunday at least, and stay warm. It's getting cold out there.